Hi guys, so I wanted to do a quick update on what my doctor has said and things that we're doing moving forward. So one of the big changes that just recently happened is I moved in with a friend of mine so that they can help me because my family was not able to help me as much as I needed to because they were always at work. And so now I'm living with them, and it's been really, really good and really helpful, especially at night. But I had a doctor's appointment within the last week, and it was for pain management, and basically what he said was he doesn't know what else to do for me, and so he's sending me to one of his other providers who does pain management for more complex cases. So that's what we're gonna do, is go with her for a little bit. And then he also talked about doing palliative care. Now, I had no idea what this was, and then he was like, it's kind of like hospice, and that kind of was like, wait, what? But he said that it's like a whole team of doctors who can help you with like pain management, coping techniques, mental health, and things like that, like all in one. And then if it gets bad enough, I can have an in-home nurse who can help me more. So, and they help people with severe chronic illnesses like cancer or COPD, things like that. So I'm a little nervous, but I am also optimistic, so cautiously optimistic, and I'll try to keep you guys posted on that. I was kind of surprised because I wanted to look up and see if anybody else who had chronic illness had done palliative care, and there were ones like from the hospital, but there were none that actually, showed like in their own home through like a YouTuber or something like that. And so I was like, I wanted to do it to show other people what it is, and then also kind of show you what I'm learning from it as we go along. Right now, my doctor said that he thinks my cortisol levels have been kind of going up and down, and so I'm on steroids to help my cortisol levels to even out. He thinks it might be either attributed to Addisons or Cushings disease, but he's not sure. So he wants to do steroids for 6 weeks, see if that helps any. If it does, then he might up the dose, or if it doesn't, then he'll stop it and then do some more testing further to completely rule out Addisons and Cushings. Because he said that could be adding to my pain, because apparently if your cortisol levels are off, you don't heal as well as you can, like from surgeries and stuff. And so he said I could have probably never healed from my last surgery. So, and that may be why I'm going like in pain. He's like, it's kind of like having a giant scab and you keep ripping it open, and never gets to heal. So he said that may be what's going on. He also did suspect adhesions, but since I had a surgery like not too long ago, he doesn't want to do surgery, which I was kind of frustrated with. But at the same time, it's not like I wanted surgery, I just wanted a quick fix so I could go back to school, but apparently that's not happening. And I apologize for the train. We are in Taylor, South Carolina, where you have trains a lot in your backyard. Hopefully you guys could still hear me. But anyway, so we're gonna be doing that for 6 weeks. And I think I'm on the 2nd week of steroids, and honestly I haven't really noticed a difference, but I don't know how long it's gonna take to actually see a difference. He didn't say anything like that. I was too out of it to ask. So I'm not sure about that, but I'll keep you guys posted and let you know after those 6 weeks are up what he says. My surgeon from Georgia, who had said he wasn't going to deal with my case, he's been going back and forth. He's like, no, I'm not going to deal with your case, it's too complicated, you need to go to a different OBGYN. Okay, never mind, I'll take a look at it. No, never mind, it looks like you only have adhesions, somebody else needs to deal with that. Well, maybe I can take a look at it. Like, he keeps going back and forth, and I'm so frustrated. Like, I'm so done with going back and forth. And he was like, okay, we can look at doing a exploratory surgery. And I almost was like, okay, great, let's do it. And my mom was like, no. you need to pause because I don't want him switching. And then 2, our insurance really doesn't cover him because he's out of state. And so Mom was like, let's just wait and give it a break. And I'm like, okay. I'm so tired and out of it. I don't care anymore. I just want the pain to stop. That's my only care in the world, is pain to stop. So, and then that was the other thing. I'm also with the friends I'm living with now. They're also helping me look into like Social Security and disability and stuff like that. And I also got a chronic care patient representative through my insurance, because I've officially qualified as a chronic patient. Took, what, 5 years, but yay, finally have it. So they're going to be doing, she comes with me to my appointments, and that really helped, especially with pain management. Like, she helped stand up for me, and she was like, this is what we need to do, we need to get stuff done, like, you can't just leave her like this. It was very like boom boom boom, whereas before they would have maybe looked at me like a drug addict. And now we got planes. Very loud outside, but my friends are sleeping, and so I didn't want to wake them up, so I'm talking out here. I'm just going to wait. You done now? Okay. Sorry about that. So, or was I? Oh, patient representative. So the patient representative comes with me, and she was also the one who said that she agreed with the palliative care and thinks that would be really helpful for me. Like I said, I'm not really sure what it is, except what I've read online and seen some videos of, but I'll keep you guys posted on what that is and if it works. I'm hopeful. But anyway, she's also, our representative is also helping me look into Social Security and disability, because I can't work right now because the pain has been so bad constantly. And it's either I'm very drugged and completely out of it, or I am crying in pain in the ball. And I've been through 8 surgeries, and I know what pain is. And it usually doesn't lay me out like this all the time, and I'm sick of it. So anyway, that's your quick catch up on everything. Still waiting for the guys to fix my wheelchair. He wasn't able to fix it because I was in the hospital on the day it was supposed to be fixed, so that never got done. So waiting still for that. I got the appointment scheduled, I think August 1st. So if they come on August 1st and fix it, I'll show you shortly thereafter what it does, and hopefully it will help me. Anyway, so that's your quick catch up of everything that's been going on here health wise. Right now we're looking into Cushings, Addisons, think it's adhesions, not sure, dealing with pain management, and then palliative care. So I'll keep you guys updated on that. And then the other thing I wanted to show you was I did eventually get my service dog. You probably saw him in the last video underneath my feet. His name is Ollie, and he is a purebred standard poodle, and it was really cool the way God just gave him to us. Like, I found his listing online on Facebook, and he's a year old, and I went to go look for him, like went to go meet him, and he met all the behavioral checks. Like, it was awesome. And so I asked Leah, I was like, how much are you asking for it? And it was way too much. I was like, I'm sorry, I can't pay that. I can maybe do half of that. And she's like, okay, we can do that in payments. So I was like, okay, I can do that. She's like, well, why don't you foster him for a week, see how he does with your family? And I'm like, okay, that sounds really good. So we fostered him for a week, and she was like, you know what? My husband and I prayed about it. We want you to keep him for free. I was like, that was huge, you know, because I had no idea how I was going to keep paying off this, you know, payment for him. And my work's kind of back and forth because, like I said, it's flexible because of my hours with health and stuff. Now, granted, my students are on vacation right now. They have a summer break for a couple of weeks, and then I'll get them back. But anyway, that was really cool. The Lord provided him. And then the trainer, they did a excerpt on my situation in our school's newspaper, and she contacted me and said she wanted to train him for free, even though she's like, usually we cost around $10,000, but I want to do it for free as a blessing to you. And I was just like, Like, that was huge. Like, the Lord just placed everything out, so I know He's got a plan. I know He's got a purpose in all this, because He has been helping me so much with everything. So I know there's got to be some purpose in what I'm going through. I just don't know it yet, and I may never know until I get to heaven. But I wanted to catch you up on that, and then when my friends aren't sleeping, I'll do a video all on Ollie, my service dog. He's still in training, but he's not perfect, but he's getting there, and he's awesome, super sweet. And I'll do a whole video on him, and then a whole video on my wheelchair. But anyway, I hope you guys have a great day, and keep smiling, keep being strong, and just do what you can today with the time you have. It may not be much. You may only be able to get out of bed today. You may only be able to brush your hair today, but those are small accomplishments. And you need to take those small accomplishments and be proud of those things. So, as my teacher once said, keep moving, even if it's 5 minutes at a time. Hope you guys have a great rest of your week. Bye-bye.